You're struggling with premature ejaculation. You find it difficult to last in bed as long as you want or as long as your partner wants. This video is for you. It doesn't matter the level of your premature ejaculation. It could be as bad as you releasing when you're still kissing, or when you're still trying to remove your boxers, or when you're trying to put on the condom, or you may be lasting 5, 7, 10 minutes but you want to last longer. In this video, I will give you 12 simple but powerful tips, tricks, techniques, and treatments for premature ejaculation that will help you last as long as you wish in bed. Number 1, the start-stop technique. There is a point during sex where no matter what, you must release. The goal of the start-stop technique is to avoid reaching that point. As you are getting to that point, you stop. After a short while, you start again. But be dynamic. Don't just stop abruptly and do nothing. You can try using your hands, your mouth, different things while you are waiting for the arousal to come down. So you go, as you are getting to that point, you stop, you do other things. After a few seconds, you start again, right? This way, you will last longer than you usually do. Number 2, the squeeze technique. When you're about to release, when you are getting to that point of no return, gently squeeze the tip of your penis, or you apply pressure to the space in between your anus and your scrotum, your testes. You apply pressure there. This will reduce the urge to ejaculate and bring down the whole arousal process. So you apply pressure at the tip of the penis or at the base of your penis, and when the sexual arousal drops a little, you continue. Again, be dynamic. Don't just stop abruptly doing absolutely nothing. You can use your hands and you can use your mouth. Number 3, Kegel exercise and reverse Kegel exercise. The goal here is to make sure that the muscles and the tissues of the pelvic floor around your genital and your anus down there, to make sure that they are well toned. Not too loose, not too tight. Imagine you're urinating and you want to stop the urine from flowing. You know that contraction you do, right? Down there, that is the essence of the Kegel exercise. Now, you're not going to do it while urinating. When you're sitting down, you're lying down, you're fully relaxed, try to contract and relax the muscles down there as if you're trying to stop urine from flowing. Do it several times. You can contract for 5 seconds and relax for 5 seconds and contract for 5 seconds. You can do that 10 times, maybe 2 or 3 times in a day. Reverse Kegel exercise, on the other hand, you're trying to relax those muscles and tissues down there rather than contracting them, as we did in the Kegel exercise. You sit down or you lie down in a comfortable position, taking slow, deep breath into your abdomen, and focus on relaxing those muscles on the pelvic floor, those muscles down there, as if you're trying to push urine out, or as if you're trying to pull in your scrotum and your testes. Hold this relaxed position for 5 seconds and let go. Do this 10, 15 times, 2 or 3 times a day. Again, there are different tutorials showing you the different styles for Kegel and reverse Kegel exercises online. And if you stay subscribed to this YouTube channel, I'm going to do a demonstration video. Number 4, relax and breathe. You know, when someone is about to ejaculate, 2 things that usually happen are the muscles of the body become very tensed and contracted, and the breathing becomes fast and shallow. Breathing faster and shallower. In this technique, we're going to reverse everything. You will breathe deeply from your abdomen, deep down there, while having sex. Also, you make sure that all the muscles from your head to toe, especially around the groin and the buttocks and the thighs, are fully relaxed. While you're relaxed and breathing deeply during sex, you discover that you're delaying the process of ejaculating. Number 5, choose a favorable sex position. Some sex position will make you come faster, while others will make you last longer. Regular missionary position, where the man is lying on top, may encourage premature ejaculation. This is because of the tension it applies in the muscles and the contraction down there and also the increase in pressure. So try different methods. You could let your partner be on top instead. The cowgirl position or the reverse cowgirl position. This is one of the best positions for you to last longer. Keep the communication lines open with your partner. If the sexual pleasure rises fast, you could let your partner know, or if your partner is sensitive enough, she will observe that the sexual arousal is getting to that point of no return. And so you stop or you slow down. And when the feeling drops again, sexual activity resumes. Or you could even decide to change to other favorable sex positions like spooning, side to side, or even doggy. This way, with the communication and the start and the stop method and the position, you will last longer in bed. Number 6, use a condom. Usually the underlying problem with most men who find it difficult to last long in bed is they get overstimulated and they get overexcited. This is where using a condom becomes very important, especially if you don't have problem with erectile dysfunction or weak erection. Condom will reduce the sensitivity of the penis, helping you to last longer. And secondly, it has a psychological effect. Knowing that the condom is there to reduce your sensitivity can help to reduce performance anxiety, and you discover that you will last longer and you even have better erection. If it works for you, fine. If it doesn't, consider using what we call desensitizing condoms. These condoms are coated with some small amount of chemical agents that will numb your penis and reduce sensitivity even more. Number 7, the distraction method. Thinking about something else during sex can help you last longer in bed. So by distracting your mind from the intense sexual pleasure, you can delay ejaculation. Don't let yourself to be too carried away with the sex, the orgasm, and the thrusting. Get distracted while having sex. Think about something else. Anything non-sexual. Once in a while, you can think about football, about politics, about business. Just take your mind away from the entire sexual act for a moment. This will reduce the subjective experience of the excitement. You reduce it, but don't do it for too long. You switch. Right? You switch, think about sex, you think about politics. You think about sex, you think about football, right? You switch that way. It's like doing the start-stop technique, but with the mind. This is powerful. Number 8, practice preemptive ejaculation. A quick disclaimer, this is not for everybody. This is for those who are comfortable masturbating. Ejaculating before the sexual act itself will help you to last longer. This is because the first round is usually the fastest. So if you ejaculate before having the main sex, you will reduce your sensitivity, your arousal. It will be very easier for you to control your ejaculation. Release before having penetrative sex with your partner. So for example, your partner could use the hand to stimulate you to ejaculating, and after a while, you can now start penetrative sex. This way you will last longer in bed. It's powerful, it works like magic, and it's obvious why it does. Number 9, prolong foreplay. Foreplay is everything you do before the actual penetration. The technique here is to make it longer. Don't just rush to penetrate. The longer you take with foreplay, the easier it is on you. It reduces performance anxiety and pressure. It will improve your sexual satisfaction for both of you, and it will allow for you to better control your arousal level. Take your time, be with a partner. Make it a goal to please her, not just yourself. In fact, you can have sessions where you say no penetration and you just have foreplay, where you do anything and everything except penetrating. This is powerful. You're training your body and your mind to calm down, to get used to the sexual arousal feeling and the whole thing, and not to be overly stimulated and overly excited. You are gaining control. You are taking charge of your emotions. Or when you want to do, make sure that the foreplay is prolonged. Number 10, practice masturbation exercises. Again, this is not for everybody. If this doesn't work for you or doesn't sit well with you, just ignore it. Masturbation exercises are techniques used to help you to gain better control of your sexual arousal and your ejaculation. So no porn and no rushing. You're going to take your time. You can use this to practice some of the techniques we've mentioned, like the start-stop technique, where you start stimulating. As you get closer to the point of no return, you stop and let it calm down, and then you start again. This way you are rehearsing, you are practicing. Or you can try the squeeze technique, or try other things we've mentioned. The distraction method, where you think about something else. Breathe, relax. So the goal of masturbation exercises is to apply everything we've mentioned, but while self-stimulating. If masturbation as an act doesn't sit well with you, don't use this method. And secondly, if you're already struggling with excessive masturbation and porn use, don't use this method. Number 11, use desensitizers. They are creams, gels, sprays, wipes, swipes that reduce the sensitivity of your penis. They contain some mild anesthetic agent that will numb it a little. So use them few minutes, 10 to 15 minutes before sexual intercourse. You can wipe the tip of the penis or the entire shaft of the penis. Then clean off every excess. Some men prefer this method because it doesn't involve you taking any pills. However, the disadvantage of this method is that it can also transfer to your partner, reducing her sensitivity and her pleasure. Number 12, use prescription pills. There are certain prescription drugs. You can't buy them over the counter, and you shouldn't. This must only be prescribed by a doctor. Could have strong, severe side effects. These are drugs we use to treat anxiety disorders, some psychiatric disorders, depression. But one of the things we notice is people on this treatment last longer in bed. I'm sure you've heard people using things like tramadol, SSRIs, dapagliflozin, tricyclic antidepressants. Again, don't look for ways to get this yourself. See a doctor and have a doctor prescribe them, and they could have serious side effects. But interestingly, some of the drugs used for treatment of erectile dysfunction, Viagra, the Cialis, Levitra, they help men to last longer in bed. So if that's something you're also comfortable with, especially if you're also dealing with erectile dysfunction, weak erection, you could have these drugs, sildenafil, tadalafil, and stuff like that, to help you last longer in bed and also help with your erections. And if you click here, I've curated a series of videos addressing men's sexual health problems. Click here and watch all of these videos to help you to solve your sexual problems and improve your sexual performance. Take charge of your health and happiness. Stay strong, and I'll see you in the next one.